Welcome to a closer look by AHSID, exploring UCB's therapy for adults with moderate to severe hidradenitis suppurativa. In this video series, AHSID aims to educate patients on management options available to them. I would like to start by introducing our moderator, Dr. Dave Louie.
Thanks, Jasmine. My name is Dr. Steve Dave Louie. I'm a dermatologist at Wayne State University, and I'm excited to partner today with my colleague, Dr. Jeff Stark, and Kelly Tuschak, the Patient Services Patient Marketing Lead at UCB. Welcome to you all.
Thanks, Dr. Dave Louie. Thrilled to be here today. My name is Jeff Stark, and I'm the head of immunology at UCB and also a rheumatologist.
It's my pleasure to be here. I look forward to sharing more about the resources available to patients to help them find access to care.
The title of this series is A Closer Look, so we will take this opportunity to dive in and learn more about UCB as a company and a specific medication from UCB, Bimzelx, bimekizumab BKZX. Jeff, could you tell us a bit more about the company?
Absolutely. So UCB is a global biopharmaceutical leader. Since 1928, just shy of 100 years ago, we have focused on creating valuable solutions that improve the lives of people living with neurological and autoimmune and autoinflammatory conditions. Our U.S. headquarters are in the metro Atlanta area in Smyrna, Georgia, but we have employees across nearly 40 countries all around the world. UCB brought to market a novel antihistamine back in the 1980s and then an important medication for epilepsy in the 1990s. Since then, we've brought many other drugs to market and have become a leader in both neurology and in immunology. Specifically, for patients with hidradenitis suppurativa, UCB gained approval in 2024 for Bimzelx, the first biologic drug that targets both interleukin IL-17A as well as interleukin IL-17F.
Thanks for pointing out that Bimzelx is a unique drug. It is the only FDA-approved biologic that selectively targets IL-17A and IL-17F, two of the key proteins that trigger the inflammation associated with HS, among other diseases.
Yes, that's right. Bimzelx is actually approved for several conditions, and they are adults with moderate to severe plaque psoriasis who are candidates for systemic therapy or phototherapy, active psoriatic arthritis, active non-radiographic axial spondyloarthritis with objective signs of inflammation, active ankylosing spondylitis, and, the topic of our discussion today, moderate to severe hidradenitis suppurativa, or HS.
Now that you bring up HS, could you tell us a little bit more about the disease state of HS?
Oh, wow. This is a topic you know only too well, Dr. Dave Louie, but happy to share. In HS, an overactive immune system produces too many inflammatory proteins like IL-17A and IL-17F. And that leads to the development of painful boil-like abscesses in the skin. HS can get worse over time as tunnels form under the skin in between those abscesses, and even irreversible scarring can develop. But beyond the physical pain and discomfort, people who live with HS can experience a severe emotional toll as well. When the physical symptoms of HS are left uncontrolled, feelings of anxiety and depression may even develop.
Now that we all know the importance of addressing HS, could you walk us through what makes Bimzelx different and how it addresses the underlying causes of HS, Jeff?
Sure. So those two inflammatory proteins, IL-17A and IL-17F, play a role in the inflammatory process of HS. And the overproduction of those inflammatory proteins in HS is thought to result in the symptoms that we see in HS patients, like abscesses. Bimzelx is the first and only FDA-approved treatment that targets and blocks both IL-17A and IL-17F by binding to them and calming inflammation in the body. There are some clinical trials that have looked at this in HS and examined how Bimzelx works in hidradenitis suppurativa. Dr. Dave Louie, I wonder if you could walk us through the results of some of those studies.
Happy to do it. As you mentioned, in two separate clinical studies for patients with HS, 48% and 52% of people saw at least a 50% reduction in inflamed nodules and abscesses with no increase in abscesses or draining tunnels at week 16, compared to 29% and 32% of people taking placebo. 33% and 36% of people saw as much as a 75% reduction in inflamed nodules and abscesses again with no increases in abscesses or draining tunnels at 16 weeks, compared to 18% and 16% taking the placebo. Of the patients that experienced at least a 50% reduction of HS symptoms at week 16, 89% maintained the reduction out to 1 year. As these results came from a less rigorous study, no conclusions could be drawn. In the two clinical studies, 22% and 20% of people saw a 50% reduction in HS symptoms as early as week 2, compared to 14% and 8% taking placebo. We can't discuss how the drug works without also discussing safety. What are the most common side effects associated with Bimzelx?
Safety is an important topic for sure. In patients with HS, the most common side effects with Bimzelx are upper respiratory tract infections, headache, herpes simplex infections with cold sores in or around the mouth, small red bumps on the skin, feeling tired, fungal infections such as oral thrush or infections in the mouth, throat, skin, nails, feet, or genitals, pain, redness, or swelling at the injection site, stomach flu or gastroenteritis, and acne. These are not all of the possible side effects of Bimzelx, and patients should call their doctor for medical advice about side effects. You should also tell your healthcare provider before starting Bimzelx if you have conditions including a history of depression or suicidal thoughts or behavior, liver problems, inflammatory bowel diseases such as Crohn's disease or ulcerative colitis, any recent or upcoming vaccines, if you're pregnant or plan to become pregnant, or if you're breastfeeding or plan to breastfeed.
Thanks very much, Jeff. If a physician and patient decide that Bimzelx is the right choice, could you discuss how Bimzelx is administered for our potential patients?
Absolutely. So yes, if a patient and their healthcare provider decide that Bimzelx is right for them, then Bimzelx is administered as 1 dose every 2 weeks for 9 doses. After that 9th dose, Bimzelx is then administered as 1 dose every 4 weeks. All of those doses for HS are 320 milligrams, and they can be given either as a single injection or as 2 separate injections under the skin. A patient and/or their caregiver, if required, can also be trained to administer Bimzelx at home using the Bimzelx autoinjector. Some patients may also use pre-filled syringes to administer Bimzelx.
Are there any conditions or specific patient types for which the use of Bimzelx is not appropriate?
It is important to note at this time that Bimzelx is only indicated for adults with the conditions that I mentioned earlier. It's not known if Bimzelx is safe and effective in children.
Thank you very much for that valuable information. I want to now transition to UCB's assistance program for patients. Should a patient and their healthcare provider decide Bimzelx is the right option for them, UCB provides many patient support options. Now let's welcome Kelly back.
Thanks for having me.
Can you describe how UCB supports patients in navigating the steps to get Bimzelx?
Sure. We have a program called Bimzelx Navigate, and that program provides resources to support patients during their treatment journey. We have a simplified approach to help getting started on treatment faster and easier. From the first dose, a patient may pay only $15 per dose if they are commercially insured. And once insurance approves coverage of Bimzelx, eligible patients may start to receive treatment for as little as $5 per dose.
So what can patients expect when they enroll?
When you enroll, you'll be paired with a dedicated nurse navigator. This is one person a patient can rely on to connect them to everything Bimzelx Navigate has to offer. They can connect a nurse navigator at 833-931-6877, 8 a.m. to 8 p.m. Eastern Time, Monday through Friday. It's also important for me to mention that our nurse navigators do not provide any medical advice, and they will always refer patients back to their healthcare professional for any treatment-related questions. But those nurses are there and committed to you, ready to answer any questions about your prescription status, insurance coverage, and treatment goals. A nurse navigator can help you to enroll in the Bimzelx Navigate Savings Program. And we also have nurse navigators that speak languages other than English, for example, Spanish. So there is no need to fear if English is not your first language. You can still call one of our nurses and speak to them in any language that you're comfortable speaking.
That's great to hear, and thank you very much for sharing that phone number. Does UCB offer any digital tools or apps to help patients manage their treatment and track their progress?
We do. A patient can stay focused on their treatment goals with tools and resources that are found online at navigatestartshere.com, where they can request a free Sharps container, receive nurse navigator contact information, find injection support resources, in addition to accessing other educational resources. To join that program, patients can scan the QR code shown here, or they can visit navigatestartshere.com, create an account, and then they will have immediate access to most of those materials. We strive to keep patients at the center of all that we do.
Thanks, Kelly, for sharing that invaluable information to patients. I also want to thank Jeff once again. I hope our discussion has helped you, our viewer, learn more about UCB as a company and about Bimzelx, bimekizumab. If you don't have to be an HS warrior alone. If you think Bimzelx is the right treatment for you, please reach out to your healthcare provider to start the conversation.
UCB is committed to patients with immunologic diseases like hidradenitis suppurativa. We're here to support you, whether you are a patient, a caregiver, or a healthcare provider.
We can help patients with HS get access to the care they need.
The full important safety information for Bimzelx is provided next in this video. Thank you very much for joining us.